Welcome to Carolina Women. We are here today at Custom Audio Video. We have a really special show for you. Our friend Jen is here from Rehab. Erin is here from Carolina Women.
Yes, or we're somewhere.
Exactly. I'm so excited to have you here today. Every time we have you, we learn something new.
We do.
And today we're going to talk a little bit about the correlation between your muscular system, your orthopedic system, and pelvic floor region.
Yes, they are so closely related, and thank you for bringing that up, because I think a lot of people hear the pelvic floor and they get a little intimidated because it's the down there, and that's usually taboo, or people are just scared or shy about it.
Exactly.
But it is a group of muscles, and it plays such a huge role in functioning. So we have our muscle system, we have our skeletal system, we have our nervous system, cardiovascular, and so much more. And everything relates together. So if you have something not working in one area, it can show up in other areas of the body. So when it comes to the pelvic floor, we don't always have to do internal exams or do a lot of what can scare people. We can take a look at somebody, see how their posture is, pick out little different nuances or faults within their alignment, and it could correlate with their pelvic floor symptoms.
What's really interesting for me is this is part of your credentialing. This is something that you really specialize in. And what I hear, Erin, I think what you and I talked about was what I hear you say in layman's language is you may have incontinence, you may have a lot of other pelvic floor issues that may be that's what I'm seeing, but it may be caused from something else.
It's a little detective work. You all kind of piece it together.
Yes,
got it. But
Okay.
I thought it was interesting how she could visually look at you when you took your shoes off. We had that off camera, but it was really interesting.
For me it is.
Yes.
Yeah, I mean, I think for everyone, you don't realize how everything is tied together.
So closely related, from how your neck is positioned, any tension in your jaw, tension into the pelvic floor, how your feet and ankle.
It can travel.
Yes, everything can travel. It can be referred pain, or it could be the ultimate cause. So let's say if somebody has previously gone through orthopedic doctors, medication, all sorts of other treatments for a hip problem or a knee problem, and it's just not getting better. Sometimes we have to broaden that search and play detective. It might be something coming from the foot, which is relating all the way up to something happening at the pelvic floor, or it could be something in the upper back that is contributing to something down below.
Can I ask you a broad spectrum question about that? So let's say Erin or I come in and we're not feeling great, maybe some minor whatever it is. Do you do a comprehensive intake to maybe find something that we would not have? I would never have come in and said my right toe hurts or my right. I wouldn't have come.
Yeah, right. Yes, we absolutely do. So if you come in and say, again, for the pelvic floor, if you're focused on a big classic one is eye leak. Well, we're going to look from head to toe and see what aspects of your movement system of your body could be affecting that, because it's not always what people suspect as weakness. So the answer is not always Kegel. Sometimes it's we have to improve your sitting or standing posture. Sometimes it's we have to adjust the strength in your feet to change how your hips are oriented or positioned to take a load off of the pelvic floor.
And then what is the treatment? So that is part of the treatment as far as like prescribing.
So if I'm aligned.
If you're aligned and your system is working 100% together, then everything should be at maximum,
harmonious.
Yes, maximum function.
Do you watch people's gait, how they walk?
Sure do. Yep.
I never even thought about it.
Me either.
I mean, I do. I've been told I pronate a little bit, but that plays into it, correct?
It does. If you pronate, your body might be naturally compensating at your knees or your hips, and then that could lead down the road to
chronic pain,
chronic tightness,
illness,
chronic weakness in other areas.
Injury.
And those injuries and pains and chronic issues can present themselves as pelvic floor dysfunction.
At any age?
So interesting.
At any age.
Okay, so that's probably another important one, because I'm talking, 70, but you're saying really anyone, anytime.
Anyone, from the teenage athlete to somebody who's just trying to go out and walk on the beach in the sand and is having some knee issues and find that they can't take that amount of pressure.
And we don't want to wait 3 decades.
No, because you got the answers now. We may not have had it before. It is always a pleasure to have you.
Thank you.
Can't wait to see you again. Stay with us. More to come here on Carolina Women.